Now it's time for Tipisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale. A Tale, oh yeah. A Tale of Two Hygienists.
Listeners, welcome into this week's Tipisode. I'm joined today by Dr. Patel. Dr. Patel, thank you so much for being here.
Oh, I'm grateful to be here.
Now, it's interesting because right as we were getting on, you mentioned that you guys are celebrating a holiday. So listeners, if you hear some sort of like whistling or popping or firecrackers, like she's safe, it's a celebration that everyone's happy and everyone's healthy. So they're just enjoying a good time. But Dr. Patel, I wanted you to maybe give our listeners a brief background before we get into the conversation about copywriting.
Okay, so I have been practicing dentistry, particularly the cosmetic dentistry, since last 4 years. I'm from India. I also graduated from New York. So talking about copywriting or particularly writing for dentists has been a very different journey. Like during my practice, I found there is a gap between the dental content which is present or communicated to the local public. Like there is so much of information, but the information is in a technical form or a robotic form, which lacks an emotional connect and which resonates. Like even if the patient is visiting to your website, they can't connect with you or their problems can't connect with them. So that was the biggest gap I found. And then I decided to write for dentist.
So you were seeing, though, is mostly from the patient's perspective, that the patients were having a hard time understanding it? Or do you feel like also, because what I see when I go to like the dental websites is it's kind of all the same.
Yeah.
You know, there's not unique content.
But the problem, what I found is that when the dentist is hiring the marketing agency, the people who write for dentist are not aware of or don't understand like what problem the reader is facing or what the dentist needs to convert to the local public. So that was the biggest problem. Problem is on the both sides, like even the dentist can't convey it the way they want to convey, and the reader also cannot resonate. Like this is the actual problem what I'm facing.
That's got to be hard. I mean, it's hard for both, you know, clinician and the patients. So when you go in and you're looking at a website, do you find that there's also kind of like just aesthetically looking at how many pages are on a practice site is overwhelming for patients?
Yeah, definitely. It could be much easier for them if there is a separate segment for each of the treatment we offer. So if the patient is looking for that. Also, if we add many of the cases, it will be trustworthy for them. They can expect what outcome they are going to get after being treated by you.
Now, for you, when you saw that there was a problem, you're looking at these websites and you're like, man, Dennis, you could have a better website. Why do you feel like you specifically are kind of the right person to fix this problem?
Okay, so like I like very much talking to people when they are facing the problem. Like most of the time, it is the counseling part before the treatment what we do. So that was missing. Like whenever anyone visits the website, everything technical is presented. What is the root canal? But no patient is interested in what is the root canal. They are just interested in how they are going to feel during the treatment, after the treatment, and what problems will be solved after being treated. Like I think they should be very short, what is the treatment, but the depth should be in how their problem will be solved, how they feel. There should be testimonials regarding the dentist they have treated the patients previously. So it will build trust. And moreover, cosmetic, like I said that I practice more of the cosmetic treatment. I was very much wondering that people are not affording. Most of the dentists I talked to, they are like, they need so much of efforts in converting people for the cosmetic treatment. But there are many treatments, like people visit to the beauty parlor regularly. They go to the salon regularly. In spite, that is not a necessary. That is a beautification procedure. Then too. Yeah. But that point, I felt that there is a lack of awareness that we need to create we need to aware the people about that. Even teeth is one of the part they can do a makeover.
Oh yeah, for sure. Did you find it hard to find the opportunity to write for the doctors' websites, or is it a huge need that you're seeing that doctors are hiring people all the time for websites?
I find a difficulty in converting them, like how I am different from the other people who writes for them, because as we are progressing, there is a much need of dental website, but there is a difference. Like what I write for them, it is from a dentist perspective to a patient. And the marketer, like whoever the agencies write for them, mostly they'll take the content which is already present on the web, just reframe it and put it. That's what my experience.
Yeah. Dr. Patel, I want to have you on for a longer episode in the future. I want to do this episode because I think there's a lot of things that, hygienists, dental assistants, and other members of the practice can contribute to the website. And I wanted to draw attention and say, look, if you're working at a place that you're just kind of a little bit ashamed of your website, if you yourself as a hygienist or dental auxiliary or whoever doesn't feel, prepared to do this, there are people out there, dental professionals like yourself, Dr. Patel, who are willing to help out. So I would love for you guys to kind of help connect this, because as Dr. Patel was saying earlier, it's really about helping the patients understand the treatment and helping them understand why they need it, not just the kind of the aesthetics looking of a website, even though it all kind of goes hand in hand. Dr. Patel, if someone wanted to reach out to you and maybe do a consult or whatever, how can they find you?
Okay, they can mail me at my mail ID is Prasanna Patel 22. That is PRASANNA PATEL 22 @gmail.com, or they can reach out to me on LinkedIn. My ID is Prasanna Patel, Dr. Prasanna Patel, and Facebook as well.
And I'll make sure I put those in the show notes so you guys can link right to it and find her. Dr. Patel, thank you so much for being on.
A tale of two hygienists.